first, thanks for the for the invitation to speak on this special day, World Patient Safety Day, on the new report commissioned by the German government on safety in the workplace. As was presented by Ingo, this is part of a series, and you won't be surprised to learn that the Organization for Economic Cooperation and Development is looking at patient safety not merely from a public health perspective, but also from an economic perspective. So what we try to do through our publications is not only to convince that safety is a problem from a human healthcare and human suffering perspective, but is also dangerous for economies. And a lot can be saved if less safety costs incurred by repairing what didn't go as it should be, are replaced by investments in prevention. And as Ingo showed, the OECD has since 2017 produced various reports combining statistics and analytics to make the case of the economics of patient safety. These reports have been the input for global safety meetings, like the one hosted in Bonn, but at the moment are also used in the G20 when ministers of finance and economics discuss investments in healthcare. So I would like to thank the German government for having the trust in the OECD of continuing producing these reports, and today presents some of the highlights of the report that is launched, Safety in the Workplace, which is basically following up on the central theme of Patient Safety Day last year. But independent of the theme, all themes in patient safety can be looked upon also from an economic perspective. So also the theme of today's Patient Safety Day of mother and child care and safe childbirth. But the theme, safety of healthcare workers, has been very wisely chosen and has proven to be extremely relevant over the past 15 months of the pandemic, because health workers have been overrepresented in the COVID-19 infections and have experienced not just the mortality and the physical consequences of COVID, but also the mental strain of keeping healthcare systems and healthcare services going. Here you see one of the tables that just tracks at this stage the number of vaccinations in healthcare services in various OECD countries. So the point the report tries to make is that improving safety of healthcare workers and outcomes is not just important from a public health perspective, but also for the financial bottom line for health systems. What you see and what will continue in the coming years is that health and social healthcare workers are a huge part of our national economy, and that will only increase given the existing shortages and developments in healthcare. But we also see that from the cost side, the costs that could be saved by reducing safety errors also come with safety and harm that is incurred by healthcare workers. We make some estimates in the report that is up to 2% of the health spending. And if you link that to the general economic analysis of what could be saved when avoidable safety harm issues are prevented, adds up to 12% of all the healthcare spending. So it poses an economic reason for working on this. The report itself basically gives 4 types of answers to address the safety of healthcare workers, and basically is set around creating the right conditions for a safe working environment. The first part addresses the focus on working conditions and culture and safety culture. The second part addresses the need to empower workers with adaptive capacity. And this has become extremely clear during the pandemic when you see that you need a resilient and adaptive health workforce. Of course, protocols are important and many healthcare processes need to be controlled, but workers should have the competences to adapt and to have efficient empowerment to act in a way that prevent safety errors. The third area we observed is the need to align different approaches to safety. The approach from the clinical perspective, clinical risk management, the approach from the corporate organization, like the hospital as a whole, and the professional risks. These three need to be grouped together, and the fourth part of the report states one of the ways of doing that is to including measures on patient safety as experienced by healthcare workers, and that can also be as part of safety culture surveys, as an integral part of the overall way how you try to ensure quality and safety in healthcare. So the reports make the case for investing in health workers' well-being to enhance health system resilience. And this point is extremely relevant given the fact that many OECD countries at this moment are looking at making investments in their healthcare systems, trying to deal with the backlog of services that were postponed, but also trying to use the momentum to re-engineer part of their systems to create more value and have more productivity. The recommendations provided in this report with respect to healthcare workers state that there should be emphasis on the flexibility of the workforce, and there are various ways and skills and competence mixes how to do that. There should be emphasis on concrete policy actions and appropriate resources to support healthcare workers. And that's not just the short-term PPA testing capacity and vaccination facilities, but also the overall legal protection and psychological support. To furnish workers with the skills and knowledge needed to deploy change. As I said, the need for adaptation, flexibility, trying to make people feel empowerment so they feel responsibility for managing riskful situations in an appropriate way, also via the teams they're working in. And overall, not just focusing on preventing of harm in healthcare workers, but promoting the well-being and safety in the workplace as an overall strategy in the healthcare system. So I hope the work that was commissioned by Germany and that was written by my colleagues Kate Bienassis and Luc Slavormirsky will find readers. And that starts with the community of patient safety in Germany that you're representing today. But given the fact that it's written for a wider audience, I hope these principles will be applied in a wider sense in OECD countries and beyond. And in that way, make a contribution via the OECD to the implementation of the action plan of the World Health Organization to create a safe healthcare systems. Thank you very much.